Hello, thank you for pressing play on this video. My name is Alyssa Fellini, and I'm a clinical pharmacist specializing in infectious diseases and addictions, providing HIV and hepatitis medication management in an outpatient clinical setting. In this video, we'll discuss the pharmacist's role in identifying and treating patients with alcohol use disorder across all practice settings. Pharmacists are increasingly recognized as essential partners in public health. What started as a profession focused on compounding and dispensing medications has evolved into one centered on patient care. Today, pharmacists play an active role in vaccination, sexual health services, overdose prevention, and naloxone distribution. That same public health focused approach can and should be extended to medications for alcohol use disorder, or MAUD for short. But often, pharmacists across different settings do not know exactly how to intervene in this type of care. Many states recognize clinical pharmacists as mid-level practitioners, with various authorities to initiate, administer, procure, and/or dispense medications, such as those for alcohol use disorder. As of 2024, all states have enacted policies allowing collaborative pharmacy practice, or CPP, enabling pharmacists to provide direct patient care services under certain conditions with a collaborative pharmacy agreement, or CPA. This expanded scope, combined with pharmacists' accessibility to the public, positions pharmacists as key players in identifying and supporting people with alcohol use disorder. Medications for alcohol use disorder are safe, effective, and evidence-based. They can reduce drinking, help prevent return to use, and support long-term recovery. There are only 3 FDA-approved medications for alcohol use disorder versus the hundreds used for hypertension. Yet despite nearly 28 million people in the US experiencing alcohol use disorder, only a small fraction ever receives medication treatment. As the medication experts, pharmacists in all settings are uniquely positioned to help close this treatment gap. We can support other healthcare professionals in prescribing MAUD safely and effectively, help patients navigate barriers and challenges to medication procurement and adherence as part of routine medication management, and can also play a critical role in care coordination if other services are needed. The pharmacist's role: alcohol screening. Regardless of setting, most pharmacists have regular, trusted contact with patients, and that creates opportunities to identify unhealthy alcohol use. Screening should occur at least annually and may happen in community pharmacies, ambulatory or specialty clinics, or during inpatient medication reconciliation. Pharmacists can use quick, validated tools or clinical indicators to identify unhealthy alcohol use and withdrawal. Validated tools can be brief and flexible, including the NIAAA Single Alcohol Screening Question for an initial screening of adults, and the Audit C for further risk stratification. The CRAFT or S2BI can be used to screen adolescents. Pharmacists can also monitor for red flags, such as medication refill patterns, alcohol-related health conditions, or dangerous alcohol medication interactions. Pharmacists may also want to consider ordering baseline and confirmatory tests, like liver enzymes or alcohol biomarkers, as their setting allows and clinically indicated, to support diagnosis, risk stratification, and ongoing monitoring alongside clinical assessment. Withdrawal screening. Withdrawal can be dangerous, and some patients may need medical management before starting MAUD. When appropriate, pharmacists should also ask about alcohol withdrawal history. Recognizing the signs of withdrawal and explaining them in patient-friendly language helps keep patients safe. Key symptoms to look out for include shaking or trembling, anxiety or restlessness, trouble sleeping, sweating, high blood pressure, fast or racing heartbeat, and in serious cases, seizures. If the patient presents with symptoms of alcohol withdrawal, ask them about their alcohol use, other symptoms, and history of withdrawal. It's important to note that each withdrawal can be more severe than the last, so getting a history is critical to ensuring safety and making appropriate recommendations for next steps. Brief education and motivational support. Even short conversations about a patient's alcohol use can increase awareness and open the door to treatment. Pharmacists are uniquely equipped with patient communication skills that are emphasized throughout all years of professional schooling. Regardless of the setting a pharmacist chooses upon graduation, these are still there and still helpful. Here are some tips for having conversations about unhealthy alcohol use with patients. Use open ended questions and non stigmatizing, respectful language. Frame conversations around safety and medication effectiveness. Normalize alcohol discussions as part of routine care and MAUD as a routine treatment option, just like medications for high blood pressure or diabetes. Emphasize that medications to help reduce drinking and cravings are available, effective, and safe. As medication experts and trusted healthcare providers specifically surrounding medication use, pharmacists discussing MAUD may be more accepted than if discussed by another healthcare professional. Discussing how alcohol interacts with common medications is often a natural and powerful entry point for these conversations. Furthermore, pharmacists already review drug interactions, so adding alcohol when checking interactions and discussing alcohol use with patients can significantly improve patient safety. Common medication classes that can interact with alcohol include opioids, benzodiazepines, sleep aids like zolpidem, antidepressants, over-the-counter pain relievers, anticoagulants, diabetes medications, antipsychotics, and high-dose antimicrobials. Importantly, it is essential for all healthcare professionals, including pharmacists, to educate patients about the risks of combining benzodiazepines and opioids with alcohol, as these can have life-threatening consequences. Treatment and monitoring. Next steps depend on state laws, practice setting, and any collaborative agreements. But in general, pharmacists may refer patients to primary care, behavioral health, or specialty addiction services, provide warm handoffs to improve follow-through, recommend or prescribe MAUD where authorized, monitor side effects, efficacy, drug-alcohol interactions, and tolerability of the medications, support patients facing barriers to accessing treatment. And even when pharmacists aren't prescribing, their role in education, coordination, and follow-up is critical. In conclusion, as medication experts, pharmacists are essential partners in identifying unhealthy alcohol use and expanding access to evidence-based treatment for alcohol use disorder. Across all practice settings, pharmacists can implement strategies to increase screening, normalize conversations about unhealthy drinking and medication as treatment to reduce stigma, strengthen continuity of care, help patients navigate barriers to adherence, and ultimately expand access to effective AUD treatment throughout the healthcare system. Thank you.